Now, if you suffer from knee pain, your doctor might have advised you at some point of time to get an injection into your knee joint to get relief from pain and other symptoms of your knee problem. Or you might have heard about knee injections from other people and heard about the magical effects of injection, as in the immediate pain relief that most people achieve with injections in their joints. Now, in this video, I'm specifically talking about the knee joint. However, this is applicable to other joint injections as well. Now, if you don't know me, let me just introduce myself. My name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage their spinal, that is back and neck, and joint pains. So I give you simple strategies, easy lifestyle changes, easy exercises, hacks, tips, and tricks. And I help you to manage these aches and pains. So let's get into the topic for today. That is one common mistake after your knee joint injections. Now, the injections can be advised for different kind of problems in your knee. Maybe you have arthritis, meniscus issues, or you've had a ligament injury in the past, or just degeneration in your knee, which is leading to symptoms or different symptoms in the knee, especially for pain, because this is a weight bearing joint in the sense we are bearing weight on it, so your body weight is being taken by these joints. And of course, if it's painful, it's very difficult to get around your everyday activities, etc. Now, there are different kinds of injections that, of course, your doctor will advise you which is the best option for you. That's not in the scope of this video. You can have steroid injections, hyaluronic acid injections. Sometimes they will also inject a little bit of anesthetic along with the injection to give you the pain relief. And it could be PRP, that is plasma rich protein, in which they take the blood from your body, and then they take out the plasma content and then they inject that into your knee joint. So there could be different kinds of injection. However, these injections are mainly for relief of symptoms, especially that of pain. So once you have pain relief, of course, the joint takes a little bit of time to settle. The doctor will advise you on this. It could be a few hours or 1 or 2 days, depending on how painful your joint was. And then when the pain settles down, then you get this pain relief in your joint. And some people even describe it as, oh my God, my pain is like completely gone. And they go back to doing whatever activities they were doing before they had the pain in the knee. So, whatever daily activities were stopped or paused because of the pain, they go back to that. Now, this is where people need to be aware that once you have pain relief, which can last from a few months to maybe up to a year or so, maybe 6 months, it really depends on how bad your knees were to start off with. So once you have this pain relief, remember two things. One is that your doctor will most probably not give you more than 2 or maximum 3 injections in the full year. And we're talking about the full body. But specifically, if you're looking at the knee, they will not give you more than 2 to 3 injections, because repeated steroid injections can lead to weakening of the tendons, that is the soft tissue, the muscles around that area. And obviously, it could even lead to tearing of the tendon, that is the part of the muscle that attaches to the bone. So that is why the doctors will not give you repeated injections. So make use of the time that you have got with the pain relief with that particular injection. Now, usually people will stop all the exercises, all the precautions that they have been taken. Now, it is not that one injection has magically reversed the whole disease process. Suppose, for example, you have arthritis. You still have that bone on bone grinding in the knee. You still have the osteophytes, that's the bony spurs or growth from the ends of the bone. You still have all that problem. It's just that the pain has been reduced, sort of has been masked for whatever number of months. This is the golden time for you to catch up on your exercises, on your strengthening for your knee, on your overall general, like if you have pain in the knee, you've not been walking, you have sort of gone into this stagnant lifestyle, it's the perfect time for you to come back, obviously gradually and slowly. It is a good idea to talk to your physical therapist if you have one, or talk to your doctor before you get the injection, and then schedule your next few appointments with your physical therapist before you get the injections, so that once you get that pain relief from the injections, you're ready for your next session with your physical therapist. Or if you have the list of exercises, or you know what exercises you're going to do, you can go back to doing those slowly and gradually. That's important. If you do not have a physical therapist, you do not know what exercises to do, it is a good idea to go to your doctor when they start to suggest that you might need an injection in your joint. That is the time to tell them, okay, I want to go to a physical therapist. Go and see the therapist and then discuss it with them. Have a plan of action, because whenever you go to a physical therapist, they will have a short term goal and a long term goal for you. So what are your goals? Why do you want to do physical therapy? Why I mean, after the injection. And they can have like a baseline of where you were before the injection, and then with your subsequent sessions after the injection, then they can guide you with your exercises within the limits of your pain or discomfort, if you have any, with the exercises after that joint injection. So yeah, so that was basically the one mistake that people do in terms of joint injections, especially with your knee, because they think, hey, the pain is gone, I can go back to doing whatever I was doing before I had this problem. Yes, you can, but you also need to make use of this golden period, because the injection is not going to last you forever. It is going to last you maximum, I mean, I can't put a number on it, but suppose, for example, it lasts you 6 to 8 months, then you have that 6 to 8 months to get your exercises, your muscle imbalances sorted out. Basically, you will have a base. Once that pain starts to gradually come back, at least your muscles are stronger, your knee is more stable, you're able to tolerate that pain better. Alrighty, so that is all I had for you today. Now, if you're looking for more tips and tricks like this, or you're looking for simple solutions to manage your spinal, that is back, neck, or joint pain, I have a free community where I do a couple of free trainings. We've done trainings on back pain, neck pain, mid back thoracic pain, core exercises, postural stuff that you can do on your everyday basis to make sure that you're sitting or standing upright in a good posture. So we have a couple of trainings there. You can join my free community. I will leave a link in the description of this video. If you're watching me on Instagram, the link is in my bio. And if you have any questions for me, do leave them in the comments below and I will address them for you. Oh yeah, also the trainings live in my free community. Once you join, you do have lifetime access to them. Alrighty, I hope to see you guys